Hello, sir.
Good evening, everyone. I am Dr. Devendra Patel. I am a consultant physician practicing in Goregaon and Malad. My special interest is to treat a cardiac patient and diabetic patient. So today I will talk on diabetes mellitus. What do you mean by diabetes? What are the types of diabetes? What is the cause which is leading to diabetes mellitus? How to diagnose a patient with diabetes mellitus and how to treat the patient. So basically diabetes is a condition in which there is an increased blood sugar level above the normal range. It is basically divided into multiple types, but we will go through two types of diabetes, that is type 1 diabetes mellitus and a type 2 diabetes mellitus. Type 1 is a diabetes where there is a decreased insulin production as it results due to viral pancreatitis or any disease which leading to pancreatic damage. Hence the insulin production gets decreased and patient develops type 1 diabetes mellitus. And type 2 diabetes mellitus is a condition which is secondary to the obesity, central obesity, and when there is a insulin resistance, patient develops type 2 diabetes mellitus. So how to suspect whether patient is suffering from diabetes mellitus? So basically a patient with newly diagnosed diabetes mellitus basically have a history of weight loss, polyuria, that is increased urinary frequency, increased thirst and increased food intake. So despite of increased water intake, increased food intake, patient will complain about weight loss. Along with this, if there is an delay recovery in the wound, then one should always suspect diabetes mellitus and get a diabetes test done. So we can diagnose a diabetes mellitus on the basis of three tests, that is fasting blood sugar, postprandial blood sugar and HbA1c. So if fasting blood sugar is above or equal to 126 milligram per deciliter, postprandial blood sugar is more than equal to 140 milligram per deciliter, or HbA1c is more than equal to 6 or 6.5, then a patient is labeled as a diabetes mellitus. If any of this test is positive above from last three tests which I told, a patient is labeled as a diabetes mellitus. So this is the test to diagnose a diabetes and how to treat a patient who is suffering from diabetes mellitus. So if a patient is having a type 1 diabetes mellitus, the treatment is insulin, that's it. There is no tablet which will improve a sugar level in a patient who is suffering from type 1 diabetes mellitus. The main treatment is to give insulin according to the sugar level. And in type 2 diabetes mellitus, first thing is the diet, the second thing is the exercise, and the third thing is the medicine. So in a patient suffering from type 2 diabetes mellitus should avoid a high carbohydrate diet. Basically a diet should be low in carbohydrate content and high in protein and moderate to normal in fat content. In such patient, a patient should avoid rice, wheat, potatoes, specific kind of fruits, sweets, and the food which contain high glycemic index. Other than this diet, a patient should always walk at least 30 to 45 minutes a day. Other than this, medicine is basically divided into two types, that is an oral medicines to control the blood sugar level and the insulins to control the blood sugar level. So basically we start with the medicines, oral medicines, where we try to control the sugar level and we try to keep the HbA1c level below the 7. So despite of giving multiple oral medicines, still the sugars are not well controlled, then we can go for insulin. So basically this is a brief idea about the diabetes mellitus. I hope you understood it better. Thank you so much.